Welcome viewers. Today we are going to discuss about a very strange disease, Alzheimer. Many times we have seen in our society that people are saying, I am forgetting everything, I am forgetting everything, I am taking medicine double time, and I am forgetting my son's name, my mother's name, and my relative's name. So this disease is very uncommon, but it is increasing day by day. So we are going to discuss on World Alzheimer Day, which is on today. Now we have with us Dr. Pranav Prakash to discuss about the Alzheimer disease. Welcome, sir. Welcome, viewers. Today is World Alzheimer Day. Welcome viewers. Today is World Alzheimer Day, and we are going to discuss about this uncommon disease Alzheimer with our public health expert Dr. Pranav Prakash. Welcome, sir. So, sir, we want to know, our audience want to know about this disease. What are the sign and symptom of this disease Alzheimer?
Yes, sir. To your viewers and to all the participants in this discussion, I would like to talk that is a very, very interesting disease, and right now getting to a large number, which is really tragic for our present society. It's one disease where brain cells have got a very unique change, and in certain histopathological studies, they have found that there is accumulation of certain protein particles in the brain cell, and that results in loss of memory, loss of cognitive function, and many such abnormalities, which leads to a very difficult life for the victim. Especially with the success of public health and with the success of the whole modern medicine effort, we are able to enhance the human life's overall lifespan to a large extent. Earlier in India also, the lifespan in 1947, it was roughly around between 28 years to 35 years as they accumulate. But now our life expectancy is going to touch around 70, and in fairly middle class people, it's going even touching 80s. Some other developed nation, it's going to well beyond 80, going to 90s as well. Now, in this condition, we are facing some unique medical problems in larger number. Earlier, when people were not living to long life, we are not very sure whether the disease was having this much large presentation or not, because the life expectancy was not that long. But now we are having a large long life expectancy. So now we are facing these diseases like Alzheimer's, where there is loss of memory function, there is loss of cognition, personality disorders, and patients gradually become very much dependent, and it seeks great attention from family and care provider.
Okay, sir. So, sir, how we can diagnose it in early stage?
Yes, Doctor. That is one of the biggest problem, because as we further understand, considering the social discussion about old age, so one of the common thing that we understand about old age is that you start forgetting things. Whenever you forget something, it's a common language to discuss that, okay,
Yes.
I think I'm getting old, so I'm not able to recall
Yeah,
things.
yeah.
So one this if we consider the whole spectrum of mental ability, at one end is a very simple condition where you are forgetting one thing or other. It's very common with every age, even young age people.
Yes, yes.
As we advance, we start taking it as if it is very normal with aging that we're forgetting one thing or other. Then starts coming a point where you forget whether you have closed your door or not. There comes other time when you start forgetting the name of people with whom you have been associated for years and decade, and all of a sudden you find it is very difficult for you to remember the name of those persons, name of institutions, all the things associated in your life. All of a sudden, if you start feeling that, many times it's difficult for you to recognize, many times you're finding it difficult to keep a tab of your medicine schedule. Like, there are many patients in my practice, so they'll tell, okay, I'm not sure whether I have taken my diabetic medication or not. They start their
Okay.
meal and then they recognize, okay, I'm not sure whether I have taken meal, and it is difficult situation. I mean,
Yes, yes,
hypoglycemic
yes,
drugs you can't take twice.
yes.
Anti-hypertensive medication you can't really afford to take it twice. Then is the condition when it starts getting dangerous. So if I, as a physician, I would say, without getting into technicalities, for all the viewers and everyone to understand, if at all you feel that your life, your interaction with individuals, day-to-day life function, if it is getting affected because of memory loss, then definitely this is a condition which needs a medical attention.
Mm,
It may be or may not be Alzheimer's, but definitely we need to take to a professional so that we get a right medical attention, right?
so only elderly people suffer with Alzheimer, or it can happen at any kind of any stage of ages?
Yes, very beautiful question to ask, and a very important thing to remember. Like all the other diseases, heart conditions,
Yeah.
earlier we understood that it's a disease of old age people. Now, unfortunately, we are seeing that even the victim of heart disease and sometimes even heart attack and severe problems also.
Yes,
The
yes.
age is getting younger and younger. Even in late uh, 20s or early 30s also, we are having fairly large number of victims of heart disease. Same way now we are facing that even Alzheimer's and the dementia associated with it. Sometimes it's starting even in 40s,
Okay.
50s also.
Yeah.
And that's why we say that it is very important, even if you're 40s, late 40s, early 50s, if you think that it is becoming difficult to keep tab of your day-to-day function, taking your medication, closing the door, finding it very difficult to remember the name of people in your phone list, then I think is the time we should get to professional help. We should seek professional help from physicians, right?
Okay. So, sir, tell us about the families and the caregivers. How, which kind of problem they face with the patient of Alzheimer, and how society takes it
G, G,
in
G.
all.
As we can understand, though as we dispel the myth that now Alzheimer's is also presented in younger population also. If we say younger, say late 40s or early
Mm.
50s, but it is still most prevalent in people who are in 60s, late 60s, especially early 70s, and further so on. And this is the same very age when the bodily functions also start not having that strong. That means patient's victim's body needs support in terms of lifting things, in terms of providing support for mobility. So at one hand, we have physical limitation, which is
Okay.
causing a havoc in patient in terms of making patient a little sad, a little depressed about his diminishing physical ability to interact with his family, interact with society. And on the other side, imagine you are not being mobile enough and you are also not able to remember the people who are visiting you, who are in your community, society. It's a double tragedy.
Yeah.
So people, the victims are many times very confused. They are not sure what is happening to them. I tell you a very interesting story. I mean, we all know about Margaret Thatcher,
Yeah.
one of the very famous prime minister of Great Britain. A such legendary lady like this, but if you watch her uh, last stages of her life, so she suffered with the same problem, and then she was. The whole world recognized that she is this legendary prime minister. The whole Britain recognizes her as a Iron Lady
Yeah.
of
Yeah. Yes.
Britain, but she herself is not able to recognize who she is. So
Mm.
watching her
Right.
in the care of a care provider, just looking helplessly in the park, it was such a tragic scene, but that is the way human life works. So in such condition, imagine how difficult it would have been to the family of individuals. So for family also, it's great emotional trauma to handle such people, and also physical and mental strain, because now you have an individual for whom you have to take care whether the person has taken meal or not. You also have to ensure that even with their limited mobility, if they are going outside and they are not able to track their way back home, like it's very
Yeah.
common with such patients that the patients wander around, though their physical ability also is diminished, but slowly they wander around, and now they are not able to tell what's their name, from where's the address, it becomes very difficult.
Yeah, yeah,
And
yes.
now Western societies and lot of commercial app and devices are coming, which is helping the care providers to track the victim. So
Yeah.
victim wear many times those digital devices, which allow the care provider and near and dear ones, friends and family, to have a track where is the victim. And the patient, there is a continuous and gradual decline. The moment this disease is defined, the patient gradually his memory is lost, gradually his self identity is lost, gradually he is failing to remember even his name, his bodily function. Then at the end stages it's also very difficult even to speak,
Okay.
even to perform motor functions. So the dependence start growing, and this becomes a huge physical and mental challenge. So many times the care provider also need care.
Mm.
If you are taking care of a victim who demands a continuous surveillance or continuous care, then the care providers many times also fall into a trap where they are again getting into depression, anxiety, difficulty in thinking about what's the course of life, how things will happen. So here also comes role of social counselors, social workers, and doctors in convincing the whole family how to manage this condition.
One more question, sir. It is a very simple one, but it is coming frequently to me that to whom we should consult first, a physician, a neurologist, or a psychiatrist, or some other specialist.
Right, right. And in Indian context, I understand that this becomes very important because we have tertiary care in urban settings, and then the institution of family physicians, we are not having that strong presence of family physician institution. But ideally, the patient first should get reported in to a family physician, one who is providing care to the whole family for a certain long duration of life. And why I am saying so? Because in that condition, very precisely, the family physician will be able to differentiate whether it is dementia because of some other reason or whether it is coming because of Alzheimer's, because
Yeah.
the family physician is privy of this whole information. Otherwise, going to a tertiary center where the history and the continuous history is not available with the patient and the the care provider, then the challenge is the patient goes through all the tests, all the procedure, and thereafter the cost incurred also starts getting higher. The accuracy of results also get longer to establish. So ideally, they should go first to the family physician.
Mm.
Then, as the family physician diagnoses the need, he can direct it to the different platform, because the end care also will be a multidisciplinary effort. It will
Yeah.
have effort from neurophysicians, then psychiatrists, then also maybe some physiotherapy is required because when there is limited mobility.
So, sir, what are the risk factors for this Alzheimer disease, in which we can say, and after some time, this person may get Alzheimer if is following this kind of lifestyle or something,
Right.
some medication?
I fear to say that this disease is, though lot of studies are being made and billions of dollars are being spent, it is still not fully understood. But
Okay.
with whatever knowledge we have to present at this particular moment of time, it is found that people who are in routine and monotonous lifestyle, repetitive work, and many times having lack of mental stimuli, those people many times get affected because to this Alzheimer's condition. Then the common culprit behind all the aging condition, obesity and lack of mobility, these two
Okay.
factors again are very strongly behind Alzheimer's. So if someone is obese and if someone is lacking mobility, it also affects his getting physical stimuli. If you're not moving enough, your eyes are not getting enough physical stimulation, you're not thinking enough. So the whole idea of a very comforted life of old age, where you are secluded to one spot enjoying your life, but somewhere it is detrimental to your mental health. Your
Mm.
mind is not being used enough. On positive side, some of the studies have found that people who are who use more than one language, two languages, and many times three languages, so their mental proneness is higher, and
Mm.
their Many times they are affected much less as compared to normal population from Alzheimer's condition. So lack of mobility, having a monotonous, repetitive lifestyle, not getting enough opportunity to use the brain cells. So these will be some of the conditions which will be enhancing the probability of Alzheimer's condition. And fatty acid also, especially the trans food, has been found to be culprit.
Okay.
The verdict about aluminium, there is a common question between the patients whether aluminium gives rise to Alzheimer's. The verdict still is not clearly out.
Yeah.
It's still not clear distinction and conclusive evidence that aluminium causes Alzheimer's. But I would like to advise as physician that aluminium is a fairly recent material to come in cooking lifestyle. Earlier people will cooking in clay pots or they will be cooking in iron pots. So let's still prefer those ancient pots for cooking or maybe copper rather than getting into aluminium or the effect of which it's still not fully understood. It's only in 150 years we are using aluminium as vessel to cook.
Okay. So, sir, what are the resources available for the family or caregivers of Alzheimer patient in community?
See, Uh, almost now all the countries have got resources, one provided by government to train about and talk about Alzheimer's condition, how to prevent. Government of India also provides information, one platform that is called Vikaspedia, where the information
Because
is available.
okay,
Then we have a different programs, and World Health Organization also has got a separate and dedicated page which is fairly updated regularly by experts, where you can find authentic information about the disease condition, Alzheimer's also. Beyond that, you can also contact your personal physicians, family physician, and as I discussed, related with all the chronic condition, we should revive the institution of family physicians with whom you can stay in touch and with whom you can get information about even preventive care.
okay. So, sir, as an public health expert and a well-known physician, can you explain any story, a personal story of a patient to whom you are treating and any experience personal?
Ji. Uh, Without taking name, I would like to tell you the case of a professor who was hypertensive and he was taking medication. And some days he complained that his blood pressure is fluctuating by a huge margin. And he was educated person, he was having a machine to check his blood pressure. And we are really clueless because his other parameters were okay and he was taking medication. Somehow one day his kids who were coming with him, so they suggested that Papa's medicine are getting short very frequently. I was not very sure, but then I asked him what time you take medication. He told his time, and then we had some fairly long discussion. He was the old patient. Gradually, it came out that he was not very sure whether he has taken medication or not. He has a time to take medication once in before breakfast and once before night meal. But he was taking again at around 11 also, just to ensure that he has taken medication. And
Okay,
being from educational background, he was very sure, he wanted to be very particular that he is taking medication regularly. So instead of 2 he was taking 3, and medicines were getting short very frequently. Then we found that in other cases also he was not having the right memory, he was not able to recall. He was invited to many uh, programs, being old professor, but he was not able to remember the name of students. He considered that okay, it is fairly okay for teachers not getting to remember the students, but students then also had this suggestion that he is not able to remember some of the very close students,
yeah,
which was really alarming.
yeah, yeah.
So we diagnosed with some help of friends and family that he is in the early stage of Alzheimer's. So we gave them some medication also to slow the process, and he was very physically active also. So fortunately for us, he could live his full life, and because of some other reason he passed away, but it was not Alzheimer's.
So, sir, what about the treatment part? What is the guidelines for the treatment of Alzheimer?
Uh, Now there is a detailed guideline available to slow the process. So first, I would like to talk very frankly to the viewers that Alzheimer's still not is a condition that can be fully prevented and that could be fully reversed. So we are not able to fully reverse it. We are not able to fully prevent it. Now, what we do? So there are different medications available, and whole protocol has developed so that when you take medication, you slow down the process of the continuous cognitive decline. So we can help the patient to the maximum extent possible.
Okay. So, what suggestion you would like to give our viewers or the caregivers of Alzheimer patient so that they can better care of the patient and they can
True,
get some
true.
relief?
So two things to all the young viewers, and especially who have the Alzheimer's patient in their family. So a common confusion or a common doubt or question is whether I will also develop Alzheimer's. It's not 100% sure that if you had someone in your family suffering from Alzheimer's, you will also develop Alzheimer. It's not that strongly genetically connected a disease. But there is some frequency or there is some increase definitely if someone in your closer family had Alzheimer's, number one. So as we discussed, to summarize, risk factor is not very high, but still there is some risk factor. Talking what we can do about it, let's be very cautious and alarmed if someone is complaining about memory loss. Let's, as educated society, do not ignore any of those symptoms. And the symptoms are common, that's why it gets ignored. So let's any loss of memory function report it to a professional so that we get to diagnose it early on.
Yeah.
And when we have early diagnosis with modern medications, at least we can slow down the process of development of Alzheimer's. That's number one. Number two. Number three, about the care of patient. And yes, before I forget, one important thing is now we have fairly common devices which can help track individual. We have smart devices. So we can take help of such smart devices so that at least in the unfortunate case of patients wandering in unfamiliar territory, going off in a city, at least we are able to track the patient and at least we are able to communicate with the patient and help the patient. That's again very critical. Technology is easily available, the devices also are easily available. So this is one way at least family could help the patient not getting lost to the city or any other place. The fourth thing about self-care of the care provider, if someone in your family is having Alzheimer's, you are providing care, so it is emotionally and physically very exhaustive. So I would suggest take turn to help the patient. If you have slightly longer family, one individual should not provide care continuously throughout the year. 1 month one person provides care, other month some other person provides care. If this can be possible, then a person in between can take a break, rejuvenate himself or herself and take good care. And if this condition is not possible, then you can join some group of people who are providing for Alzheimer's conditions. So that way also you can help others and you can get help from others, right?
So, as per the advised by the Dr. Parnav Prakash expert from Public Health Department, viewers, it is clear that we should not ignore the early sign and symptoms of the Alzheimer, and we should better care the suffering person. And thank you so much, sir, for awareing our audience about the Alzheimer.
Thank you, sir.
Thank you so much.
Thank you.
Thanks, sir.